Good afternoon. I'm very lucky to give this lecture at the end of this session because I have an excellent introduction from all the previous speakers, and I will focus on another entity, the primary ovarian insufficiency. This is my disclosure. And primary ovarian insufficiency as alternative names, primary ovarian premature ovarian insufficiency, premature ovarian failure, or diminished ovarian reserves. And all these names come to describe the fact that the female entered to menopause in earlier age than she is supposed. And what is the normal age for a woman to enter to menopause? And as you can see in this figure, the 50th percentile for a female to enter to menopause is about 50 years of age. And this really tells you that 50% of the female will enter to menopause between age 50 to 60. So everything that is before 40 years of age is considered pathological. And the definition of the premature ovarian insufficiency will be having the triad of amenorrhea, lack of menses, which must go for at least for 4 months in a woman that is 40 years of age, less than 40 years of age. And it is accompanied by low estrogen levels. And when the ovary doesn't secrete estrogen, there will be no negative feedback, and the FSH level that are secreted from the pituitary will be elevated. So the triad will contain also elevated serum FSH level that need to be repeated in different measurements. What is the prevalence of premature ovarian failure? And the data that we have and that is repeated is really is very scarce. And you can see that it's about 1% of the female will experience ovarian failure before they are 40. But if you look at the details, you will find that while it's about 1 in 100 female in their 40s, it will be only 1 in 1,000 in females that are between the age of 20 to 30, and it will be 1 in 10,000 of younger females. And as I'm a pediatrician, I will focus on this age group that we will see now. So this incidence and the numbers that we have, there are very, very, very few epidemiological studies. And the data that we have is actually from '86, which was one epidemiological study that they followed females for several years until they developed this phenomenon. Nevertheless, in 2015, there was another study that was published, and this comes from the United States, where one clinic published that during 15 years, they had 15 cases, new cases of girls with adolescent girl with premature ovarian failure. But what they noticed is that there was a clustering of 13 of these cases that occurred within 5 years. And the authors concluded that they think that further investigation into potential environmental and genetic precipitants is needed. So what do we know about the etiology of premature ovarian failure? Actually, as you can see in this graph, we don't know much. And 90% of the female that will come with this diagnosis, we will not have the etiology for what happened. And this may be the result that the insult occurred many months or maybe many years before that girl was diagnosed. What do we know is that there are genetics reasons for premature ovarian failure, mostly involve the X chromosome, and the highlight will be Turner syndrome. These girls have premature ovarian failure. Then there is the Fragile X syndrome, and other genes that were recently discovered that will interfere the ovarian function. We know that there is autoimmune insult to the ovary. It could be either isolated only to the ovary, it could be ovary and adrenal, and it could be part of other autoimmune condition associated with thyroid disease, celiac, type 1 diabetes, and other autoimmune disorders. We heard a lot today about toxic insult, and as any other organ, they could be toxic to the ovary. The very well known is chemotherapy, radiation, but other chemicals were found to insult the ovary. And we know that there are infections that can cause premature ovarian failure. Most common is the mump infection, but other viruses or pathogen were also described. But what I want to emphasize that when we talk about genetics, it's also the genetic susceptibility. Because if you have genetic susceptibility, you can develop the autoimmune disorder, you can be more susceptible to toxic insult or to infectious disease. So about 4 years ago, there was the first publication about a possible association between the HPV vaccine and a girl that was 16 years old at the time, and she developed this after she got the human papilloma vaccination. And we heard a lot about the human papillomavirus today. It's a cause of premalignant and malignant lesion, at least associated in the human genitalia, in the anus, in the male genitalia, in the oropharynx, and not only premalignant and malignant, but is also the causation of genital warts. Just looking at cervical cancer, cervical cancer is the third leading cancer in women worldwide, and it's still the fourth most common cause of cancer-related deaths in women. And this is why when the vaccine came, we were all happy from the medical community, hoping that we can get rid of these diseases. And currently, as you heard, there are 3 vaccinations against the HPV, the violent vaccine, which is against the virus particles 16 and 18 that cause the cervical cancer. And then we have the quadrivalent vaccine, which protects not only against the cervical cancer, but also against the cervical warts. And just 2 years ago, the 9-valent was licensed, and now it contains also protection plus 5 additional oncogenic types. And this one was approved for females aged 9 years old to 26, and also for males aged 9 years old to 15. So the vaccines are not different only in the particles of the virus that they contain, but they differ in the adjuvant that they contain. And the Cervarix contains aluminum hydroxide, while the Gardasil contains aluminum hydroxyphosphate sulfate, the amorphous form, and the 4-quadrivalent contains 225 microgram, while the new one, the 9-valent, contains a double dose of the same adjuvant. And when you talk about the aluminum adjuvant, as we heard this morning by Exley and colleagues, we now know that the forms of different aluminum adjuvant differ in their physical and chemical properties. And while when you speak about vaccination and you say, well, maybe it's the aluminum people like may raise the brow, the only vaccination that contains the aluminum hydroxyphosphate sulfate are the Gardasil and the hepatitis B. In fact, the effect of this different aluminum adjuvant was studied with the HPV L1 antigen before the introduction of this vaccine. And in this study, they studied 3 formulations. And what you can see is that the binding capacity of the 3 different formulations was different. And this is the amorphous aluminum hydroxyphosphate, which binds much stronger to the HPV antigen. And also, you can see that it causes increased response with a much larger, much substantially increased antibody response compared to the other aluminum adjuvants. Maybe this is the reason that this composition was chosen to be in the Gardasil. Another thing that it happened, that it induced a substantial interferon gamma-secreting T-cell response, which indicates a potential for enhanced memory response, which can last for several months, maybe years. So what is the connection between aluminum and premature ovarian failure? And we think it could be in two ways, either the toxic effect or an autoimmune effect. And as I said, we heard a lot about the toxic effects, but from clinical point of view, also it was mentioned today, exposure to aluminum in patients that were on dialysis caused encephalopathy, dementia, osteomalacia. We know about lung disease, and of course, about the site of the injection. So if we'll focus on the reproductive system, there is only limited study on the impact of aluminum on the reproductive system, but there are few animal studies where aluminum sulfate was given in drinking water, either to mice or hamsters, and it was found that with increased dose of the aluminum, there was increased aluminum levels in the ovary and also in the serum. And when we looked at they looked at the production of estrogen, progesterone, and testosterone with the increased doses, there was a decrease of aluminum, there was a decrease in the ability of the ovary to produce these hormones. What about the autoimmune effect? And we heard from Dr. Konduk that adjuvants are given in order to accelerate and prolong the immune response of the body, and aluminum really does it. And we heard a lot about ASIA syndrome, that several conditions are induced by the stimulation of the immune systems by aluminum and other materials. We heard about the macrophagic myophysis and the post-vaccination phenomena, and I'm not going to repeat it. And also, Dr. Dojan talked about the animals, so I will skip this study. And the clinical manifestation of the ASIA syndrome are fatigue, arthritis, myalgia, neurological manifestation. What about primary ovarian failure? Can this be also another facet of this syndrome that we look less about it? And so this is one of the reviews that were done about this question. And you can see here 5 clinical cases of adolescent girls, all of them young at their diagnosis, between, what can I say, 15 and 23 years old. They were several years after menarche, and they all had normal menses before they had their vaccination. In these specific cases, all of them had the HPV4 vaccination. They had workup diagnoses that included all the genetic studies that are done, excluding abnormalities in the Y chromosome and Fragile X abnormalities. 2 of the 5 girls had a positive anti-ovarian antibodies or thyroid antibodies, suggesting that if you have a tendency to autoimmune disease, maybe once you are vaccinated, you are at risk to develop another facet of this disease. So one would wonder, how come that there are side effects of the disease that were not firstly seen when they did the safety studies? And you all know that when they did the safety studies with HPV, and really large studies with 13,000 females, most of them received the aluminum hydroxyphosphate as a placebo, and only a very small amount of the females got the saline placebo. Not only that, if you look about the sub-study that was done in adolescents, actually 50% of the adolescents that were injected were lost to follow-up at 12 months. they did not collect data on side effects that occurred 7 months after the injection of the vaccination. And finally, many of these girls that were active, as we do in many other studies, were on contraception. And while you are in contraception, this may mask the effect of your ovarian function, because if you are on pills, you don't see that you don't have your menses. So what about studies that were done after the license of the HPV? And this is a study that was published in JAMA Pediatrics in 2012, and they actually followed since 2006, 44,000 females got the injection, and they were looking about the side effects of the study. And the conclusion of the study are that this study did not detect evidence of new safety concerns among all these females that were vaccinating. But if you look at the details, you will see that the safety study that was assessed by monitoring was actually all the girls that came to the emergency department and were hospitalized. And we all know that girls that have dysregularity in their menses or menopause or whatever will not come to the hospital and will not be hospitalized to do the workup. So this side effect will not be detected in these specific post-vaccination studies. What we do know is, again, as Lucia said this morning in her lecture, is by reports that we have from the virus or other agencies that collect reports. And by now, this is, we accessed this one at just recently. There are 200 reports of ovarian failure or menopause or amenorrhea that were associated with HPV2, HPV4, and HPV9. Interestingly, 185 cases were with the HPV4 and HPV9. And as I mentioned before, this doesn't say anything about causation, and you don't really know what the history in these cases are. But if you look, before the introduction of this HPV, there were almost no reports about premature ovarian failure. So I would say this is an article that was published in the New England Journal of Medicine several years ago about the benefit of the HPV. And I would just mention that in this particular article, they talk about anal lesions and anal malignant disease, and it was significantly decreased due to the vaccination. So it's not that it doesn't have benefits. And I would just want to summarize that the long-term ovarian infection was not assessed in the human vaccine trials, and the safety was not assessed in the post-vaccination studies. Most primary care physicians will not be aware of the possible association between the vaccination that was given months, years ago, and the development of premature ovarian failure. And that there have been increasing reports about premature ovarian failure in the virus. I would also like to mention that the HPV vaccine was not studied in children with health problem like children with autoimmunity. And maybe we should reconsider and think at least on children with medical history of autoimmunity, family history, if they had history of allergic in previous immunization, and those who are maybe with a predisposition for autoimmune disease, and think twice if these children need to get the injection. Thank you for your attention.